Well, I really don't think so. I think is the opposite. I think the use of devices such as wearable, okay, will support and enrich, and actually, in my view, they are even a great promise, okay, for healthcare, because it helps to get data in a passive manner for all of them. In phase we're doing so, we're using it, okay, for recording passive data and continuous data and deep data regarding the patients. The information that we give when we go to the clinicians or to the doctor, okay, is not the full snapshot, okay, of us. In all what is wearable technology is about app and software, okay, that is used to record and to have healthcare related data in a remote mode, and this allows to provide a lot of data of the patients and of the people in their natural setting. And I think that's quite important, and that also enriches a lot of the data, like it could be sleep, it could be information regarding adverse effects of medicaments, or it could be like new information that is gathered by the clinicians, like for example about activity and mobility, as we do in phase. And this is taken as a new as a new marker, okay, regarding your quality of life. So I think it's important because it reaches a lot of the clinical information, and not only enriches but also provides deep information regarding your lifestyle, your vital signs, and regarding your wellness, and this really helps the clinicians. Although it is true that it still has many challenges, okay, there are many scientific challenges to use this kind of lifestyle wearables, okay, because with medical devices, they are fully approved by the medicine agencies. The issue right now is about when to wear a lifestyle device, okay, like it will be a wristband that takes your vital signs, or a medical device that is on purpose do for that. So still there are many challenges. From those are scientific, some of them are ethical, some of them are technical or from the infrastructure point of view, and some of them are regulatory. So from scientific point of view, okay, it's true that many times they have not been totally proved, okay, to actually support, okay, what they made clinically, okay, be supporting, and sometimes there is still a gap in between the biopharmaceutical area, okay, which is or maybe more drug oriented domain, and the domain of electronics that is bringing all these devices. So still I think this gap needs to be covered. Still there are some regulatory and ethical gaps, because still many consents need to be done due to the fact that they are taken as different devices, okay, by the regulation. There is this fit for purpose thing that still lifestyle devices do not reach, okay, because how they are put in the market with the certification they have. So they have not been proved to for their purpose to really maybe help people with in our case with cancer, okay, and things like this. Also, it is true that still some infrastructure is needed, okay, because the devices, or there are many lifestyle devices, many wristbands, for example, just to take them as an example. It could be some other devices, it could be some other applications, but even in the universe of these applications, even in the universe of all these wristbands or any of these devices as such, the issue is that for example, the terminology is not the same. If we take, for example, movement as part of your indicator of a quality of life, some people talk about steps, some people talk about activity, other about movement. So there is no standardization in the terminology. So still there is a lot to do to actually support, okay, healthcare in this. But for sure, overall, I think it's the opposite. It's a great promise, okay, but still with many challenges in the middle.
Thank you.